Good morning. Welcome to World No Tobacco Day. Why we are concerned about tobacco is it is a prime cause for the heart disease that is going on increasing to an epidemic level not only in India but globally. You may all wonder by meaning tobacco what we intend to say. Tobacco has major two components. One is with smoke, another is without smoke. Without smoke is the various forms of gutka, the pan parak. In villages, some of them use the snuff, all those things. And the smoking involves either it is a cigarettes or a cigars or BD, whichever it may be. Why we are very much concerned is this using of tobacco, either of the smoke form or a smokeless form, is nearly about 30% in our nation, and about 11 to 12% are in the form of smoking, and about 20% are in a smokeless form. Why we are concerned about is this is a major cause for heart and blood vessel related diseases. WHO has labeled under the category of non-communicable diseases, the heart disease, diabetes, and an obstructive lung disease as cancer, as top on line 4 diseases. And the 4 shared risk factors for them all. The first one is physical inactivity. Second one is an unhealthy diet. Third one is a harmful consumption of alcohol. Fourth one is smoking. You may all wonder how this tobacco causes this heart problem. Tobacco contains lot of chemicals including nicotine. They are challenging upon the inner layer of the blood vessels. All of us know every organ in the body has to be supplied with blood, and the tubes or the tubules which supply the blood to the heart are called as blood vessels, or we label them specifically as coronary arteries. These tobacco products go and damage the inner lining of these tubes, and slowly the inner lining is getting damaged to a very great extent that a clot is formed over that, and it causes a total block. And this goes on for so many years with damage. At a particular time it goes and blocks the total blood vessel fully. Immediately the patient gets a heart attack. Suddenly he gets a chest pain or arm pain or a throat pain or a sweating or breathing difficulties or falls down dead. That's a way of presentation. And not only the blood vessels of the heart, it can involve the blood vessels of the brain also, because it involves blood circulating organ. That's a blood vessel. It goes from head to foot. In the head, when it affects it, it becomes a stroke. We get a paralysis. We call it as a brain attack or a stroke. And it can also affect the abdomen. The blood vessels, it can cause an aneurysm or a big dilatation of the major blood vessel of the stomach or the abdomen we call it. And it can also come down to the legs, and it can narrow the blood vessels. And you may be aware of the fact that sometimes the toes or the foot itself becomes blackened and then withers off. We medically call it as a gangrene. Therefore, these tobacco products affect the circulation from head to foot, and the major one is the heart attack. And suppose you talk about it, how to prevent this attack. There are various ways we do that. For treating also various methods available, but the key factor as the medical professionals we suggest to the public is you stop going towards tobacco in any other form. And you may ask, I don't smoke, I don't use tobacco product. There is an entity called as second hand smoke. Somebody who are nearby also inhale, and they have a 30 to 50% increase in the heart attack. And the youth may also ask me, Dr. Sir, now there is an entity called e-cigarettes. Can we encourage that? That also has these chemicals to a limited extent, but slowly that is also raising the blood pressure, Now science has proved that the e-cigarettes also increase the stiffness of the blood vessels, and ultimately it may damage the interior and end up in a heart attack. Therefore, nothing in the tobacco and tobacco allied products is safer towards your heart and vascular system. And you may wonder, once you quit it, the changes are very remarkable. Even within about 8 hours of stopping that, the blood circulation is increasing, the oxygen saturation is increasing, and the risk for a heart attack starts coming down. When you do that for about 5 years, nearly 50% of the risk is gone. When you do it when you are quit for 15 years, you are equated to a non-smoking person, and the risk is as same as a non-smoking person. I think as public, I think you will have to, put this into your mind, ponder over that, and try to reach to totally, avoid a heart risk, because heart is life, life is heart. Now you may ask that I am finding it difficult to quit, I am doing it for so many years. Quitting is always possible. But what you need is a strong, committed mind. If you have a strong mind, definitely your family will support, especially your children will support, and your doctor is always available to support you psychologically, and with some of the recent drugs, it should be possible. I only wish on this World No Tobacco Day, and all the citizens in the world try to abstain from various products of tobacco and try to have a healthy heart for a healthy life. And you quit tobacco, you quit heart attack. You quit tobacco, you quit stroke. You quit tobacco, you quit a gangrene. And you quit tobacco, definitely you will have a long, healthy, heart healthy life. Wish you all a heart healthy life on this World No Tobacco Day. Thank you.